Assalamu alaikum. My name is Fatima bint Tahir and my roll number is PP1650066. I'm from group number 33. The main topic that has been assigned to my group is adverse effects of drugs on liver, and the topic that I am going to cover is herbs induced liver injury. So, starting from the introduction, liver injury or any liver disease associated with the consumption of herbal medicines or agents is referred to as herb induced liver injury. Talking about the causative factors, hepatotoxicity from herbal medicines could result from many factors such as use of herbs with unknown toxicity, uh, incorrect identification leading to substitution of a non-poisonous herbal agent with a toxic one, deliberate contamination with hepatotoxic non-herbal drugs. So causative factors could be many. Furthermore, talking about the symptoms, liver injury induced by drugs or the liver injury induced by herbal medicine symptoms are somewhat similar. Body basically consider these herbal agent as a foreign one, and so these agents undergo metabolism. During their course of metabolism, certain metabolites are produced. So basically, those metabolites are reasons for producing liver injury in susceptible individuals. Here we have statistical data which was taken from the survey showing that out of 7,511 patients suffering from liver injury, 25% patients, that is 1,874 patients, were those which had liver disease due to herbal medications. Looking at the clinical features, we come across that the chance of having liver toxicity due to herbal medications or herbal agents in female is much more higher than male patients. Or injury type. Injury type could be hepatocellular, cholestatic, or the mixed one. Injury type or pattern of injury is basically a distinct pattern or factor which differentiates one disease from another, or it is basically the characteristic of that disease. For example, as discussed over here, in hepatocellular pattern, there is an elevation in serum alanine and serum aspartate enzymes. Both are basically aminotransferases. And in case of cholestatic injury type, there it is associated with elevated serum alkaline phosphatases. These enzymes are basically responsible for proper liver functioning, and any change in the concentration of these enzymes is responsible for causing liver injury or liver toxicity known as hepatotoxicity. Causative herbs, uh, most of the herbs which are or herbal agents which are responsible for producing liver injury, they are of Chinese origin. Difficulties in assessment. A very little record is available on the liver injury induced by herbal agents that simultaneously make the assessment very difficult. Why? Because most of the individuals don't even consider herbal agents or herbal medication as drugs, irrespective or unaware of the fact that they are very toxic or they can cause severe harm to our vital organs. And most of the times they don't even admit to their doctors mm, about their intake of the herbal agents. Another problem is that herbal agent or herbs are usually mixture of several ingredients or plants harvested during different seasons and extracted through variable procedures, which makes the identification of both the pharmacologically active and toxic compounds difficult. And contamination of herbal agents with microorganisms, fungal toxins such as aflatoxins, pesticides, heavy metals, and synthetic drugs has been described. So, these factors should also be taken into consideration, that why it is difficult to uh, assess the patient who is suffering from drug induced liver injury. Okay. Classification of herbal hepatotoxicity. Liver injury is basically defined by alanine aminotransferase GPT, also known as glutamic pyruvic transaminase or an alkaline phosphatase. And R ratio. R ratio is basically equals to the ratio between GPT and ALP. Higher the concentration or the amount of GPT, higher would be the chance of liver disease. Okay, so on the basis of the R ratio, hepatotoxicity is classified into hepatocellular injury in which the R ratio is greater than equals to 5 and GPT is greater than equals to 2 times into the upper 2 times of upper limit of normal range of GPT. In case of cholestatic type of injury, R ratio is greater than equals to 2 and ALP is greater than equals to 2 times of the upper limit of normal range of ALP. In mixed type of injury, R is the value of R is greater than 2 and less than 5 and both the GPT is greater than equals to 3 times of the upper limit of GPT and ALP is greater than equals to 2 times of the upper limit of normal range of ALP. Case study. Okay, so here we have a case study of a 49 years old man who is found to have elevation in serum aminotransferase level 2 months after starting Jinbu Huan anodyne tablets. He has not informed his physician he is taking these natural sedative and analgesics and continued it despite the liver test abnormalities. He was asymptomatic of the liver disease and had no major other illness. His medical history included inguinal hernia repair, appendectomy, kidney stone. He is not taking any conventional medications, denied alcohol abuse, and has no previous history of the liver disease or risk factor for viral hepatitis. His serum aminotransferase levels are known to have been normal in the past. However, after taking the herbal remedy for taking 2 months, for like 2 months, this man now is experiencing fatigue, fever, and mild abdominal pain. Physical examination are unrevealing. Laboratory tests show serum ALT 274 unit per liter, AST 154 units per liter, alkaline phosphatase that is ALP 249 units per liter. Normal range is given which is 96 to 279 units per liter. GGT 110 units per liter and bilirubin 0.8 milligram per deciliter. Normal range for bilirubin is 0.3 to 1.8 milligram per deciliter. Tests for hepatitis A, B, and C are negative, as are antibodies and alpha 1 antitrypsin level, ferritin, and iron saturation. Uh, Test for screening for these three are also negative. His serum ALT and AST remained elevated, and 10 months after initial presentation, he underwent liver biopsy. At this point, he admits to the use of Jinbu Huan, which he has started approximately 2 months before his liver test. Um, Tests are found to be abnormal. So we will analyze this case study in the form of soap note. But before heading towards our soap note, talking about this particular drug Jinbu Huan, it is basically a Chinese herb and is used for a century as a mild sedative and analgesic. It is recently marketed for arthritis and orthopedic pain and gastrointestinal complaints. Jinbuan products have been implicated in more than a dozen cases of idiosyncratic, clinically apparent acute liver injury, but the hepatotoxicity is likely due to contaminant rather than Jinbuan itself. Now we will analyze the case study. First of all, the first thing in soap note is subject. So the chief complaint is of mild abdominal pain, fatigue, and fever, and the onset of this complaint was after 2 months of taking the herbal medicine. His medical history includes inguinal hernia, appendectomy, and kidney stones. Okay, objective. ALT, AST, APT, GGT, four of them are elevated. Their values shows elevation during the time in which he was taking the medicines. Screening for hepatitis A, B, and C is negative. Test for these three, and also antibody screening is also negative. Then we have assessment. The case history is somewhat typical of herbal induced liver injury in that patient didn't inform his physician. Basically, he didn't inform his physician that he was taking a Chinese herb when he first presented, believing that it was a natural product and unlikely to be harmful or medically important. Even when asked directly, patients might deny taking herbal medication, often because of the perception that Western physicians are hostile to the use of natural supplements and would be critical of their use. Basically, patients most of the times don't tell their doctors about the intake of the herbal agents because they are totally unaware of the harmful effects not to the liver but also to the other vital organs. The clinical presentation resembled the chronic hepatitis being marked by serum aminotransferase eliminations because in case of chronic hepatitis at start the patient suffers from abdominal pain, fatigue, uh, dizziness, etc. So plan. Okay. So plan would be to stop the medication because this disease is not self-sustaining because and we don't have his biopsy reports yet. So pattern of injury could be um, calculated by we can calculate or we can find out about the pattern of injury by the laboratory test report. And the plan is to stop the medication. Why? Because the disease is not self-sustaining and resolves when the medication is stopped. So here I am concluding my presentation. Thank you so much.